Alright, Nurse Franny again. We are going to go over a lot of stuff. Here's your clavicle. This is your scapula. This over here where the pencil is drawing right here. This is the spine of the scapula. This is your supraspinous fossa right here. Pencil there. The supraspinous fossa. This is your infraspinous fossa right here. In the back. If I were to grab the same exact right here, same exact scapula right here, and pull it away, inside is your subscapular fossa. Subscapular. This is your sternum. The whole thing is your sternum. This is the manubrium of the sternum. This is the body of the gladiolus of the sternum. This is the xiphoid process of the sternum. Remember, of the sternum. This is the right clavicle again. This is a hyoid bone, free-floating bone right here. So we have ribs 1, 2, 3, 4, 5, 6, 7. Attached with hyaline cartilage to the sternum. These are true ribs. Ribs 8, 9, 10, 11, and 12, the free-floating ribs, right? I'm actually missing some ribs here, I think. Oh yeah, right here, 11 and 12. So false ribs we have 8, 9, 10, 11, and 12 are false ribs. But floating ribs are just 12 and 11. These two are floating, and they are also false. 7 cervical, 12 thoracic, 5 lumbar. You have your pelvic girdle here. Okay. You have your ischium on the top, ischium. This is your iliac crest. On the front, you have your pubis. These holes are the obturator foramen. If we bend this guy over, back here is the ischium, and this over here is the ischium tuberosity. This is tuberosity back here. Now down here we have the head of the femur. This is the anterior view. Head of femur. It articulates into the acetabulum, right in there. Acetabulum's right in there. Right in there where my pencil is. This is a pubic symphysis right here, also made of fibrocartilage. Your femur. Right here, where this little aluminum cylinder is, that would be your teres ligament, or your round ligament that protects an artery that goes into the head, to this little foramen here, which is called the fovea capitis. F-O-V-E-A capitis. It actually, this all protects blood flow into the femur. Still on the anterior view, we have an articulation inferior here with the tibia, the fibula. We have lateral and medial condyles. I forgot to talk about the humerus, which is over here. Humerus. We have the radius and ulna. Radius with the thumb, and ulna right here. Looking back up at the scapula, see the spine? The spine goes straight right here. And down here, this over here is called the acromion. This is your coracoid process, and this over here is your glenoid cavity. Okay. Remember, this is your tibia. It bears a weight. On the side is your fibula. Down here, this here is your ankle bone, and here too. This is a medial malleolus of the tibia. This is a lateral malleolus of the fibula. The tibia, right here, articulates inferior to the talus, which is a very first tarsal bone that connects. This is the only one that connects to the tibia. Down here, this is your calcaneus. And in the front, this little guy right here, that's the navicular. These are your tarsal bones. These are your metatarsals. These are your phalanges. The same way that these are your carpal. We have 16. These are your metacarpal. These are your phalanges. I think that's all for bones. I think we're done. Axial skeleton is just head and trunk, and the appendicular is your appendages, your arms and your legs. Don't forget that here you have the patella, is your knee right here. The patella is a sesamoid bone. Here you would have another patella. Oh, olecranon. Your olecranon is your elbow. So this little C-looking bone right here, your elbow, that's the olecranon, and it goes inside the olecranon fossa. That's the olecranon fossa right here. These this little protuberance right here, that's your medial epicondyle, and this is your lateral medial and lateral epicondyles.